welcome. I am especially excited for this conversation because I have been intrigued by UpaCare for quite some time. And in particular, I'll tell you why I've been intrigued, because the idea of working with my wife has been a bit of a dream of mine. I wish, and I love the idea of seeing that and seeing it flourish and seeing it succeed. So without further ado, I would love for us to get into some introductions. So I'll leave it to you. Sumi, maybe we'll start with you.
Yeah, sure. So hi, I'm Sumitra. I am CEO and co-founder of UpaCare. A little bit of background about me. So I was born in Nepal, but I grew up mostly in the UK. I went to secondary school and did my A-levels in London. And then I moved to Bristol to study medicine at the University of Bristol. And that's where I met Nav.
Yeah, I guess I'll bring that on to me. So I'm Navdeep, but Nav is cool. So I'm the co-founder and chief medical officer at UpaCare Health. I was born in the UK. Before I went to Bristol, I did an undergraduate degree in microbiology and immunology. So after I finished that in Newcastle, I then went to Bristol, studied medicine, and that's, as Sumi said, where we both met.
Yeah.
Wonderful, wonderful. I've got a further connection to the two of you. My older sister is an anesthesiologist as well, so I am a little familiar with the sheer amount of work that it took for her to achieve that profession. So definitely a warm spot for us. And I remember very early on in her career, it was very much so like, so wait, are you just responsible for the drugs and putting us that's all you do? You don't do anything else? So that became quite a sore spot for her. I'm now very familiar with the depth of what the field entails, and know for a fact that I should not just limit it to that, because my older sister will get quite angry with her little brother.
No, don't worry about it. So I specialize, well, before I started doing UpaCare, my specialty was anesthesia and ICU. So essentially, people tease me that, I just talk them to sleep. I don't even need to give them drugs. So.
She is very good at it. She's very, very good at it.
But the ICU component in that is absolutely what should be at the forefront of that role, in terms of, listen, when you hear code blue and you hear that someone's crashing, who do you think comes running, little brother?
Exactly,
like,
right?
Okay. Yeah, that's a lot more important.
Exactly. But I don't mind my patients asleep. No, it's okay. It's okay with me. I can manage all their physiology. That's not a problem.
She's a people person.
I'm really a people person. Yeah, that's why I became a doctor.
It's interesting. I'll pivot to our next question, because you've already kind of touched upon it, in that the both of you have met in school. I'll say again with my sister, she's going to enjoy the fact that I'm dropping her Nairman Malik, Dr. Malik, within in the Toronto area. So she met her now husband of more than a decade, also in medical school. He's a surgical oncologist. So I get a sense of, I think that's a bit of a common story. But with the two of you, as you met in school, different programs, different fields of specialty. How did you guys actually come to start spending a little bit of time together, and obviously a lot more time together?
I was going to say, I guess the whole meeting your partner in med school is quite a common story. I think that's because we spend such a long period of time working together. So when we were at uni, I guess we were actually in different years. But we kind of met more on socials, didn't we? I think I'll let Sumi take this story, because I feel like she tells it better than me. But
I don't tell it better. But we basically met at what's called like a medics bar crawl. Do you have bar crawls in America?
Yeah, of course, absolutely.
Yeah, okay.
I mean, sorry. No, I'm not familiar with the concept.
That's what we told people initially as well.
We were like,
perhaps that's a British thing. I'm not sure. But yes.
Essentially, yeah. So Nav, well, we both, it's like a big social event in Bristol. It's a bar crawl. So, every year, you kind of go as like a different themed person. So if you're a fresher, if you're a first year, you have to wear nappies. Second year, go in pinks. And if you're a clinical year, so that's sort of like third to fifth year, you go in scrubs. So we basically, it was a bar crawl. I kind of walked into the pub and I remember seeing Nav. Like, I'd never seen Nav before that, despite the fact that we were in the same city for the last year.
That's exactly it.
And there was a bit of a like, oh, who's that? But then nothing else really. And I saw that he was in pink. So I was like, oh, he's, you know, young. Like, and he looks young as well. Or he looked young. So, but then he came up to me and started talking to me. And initially I kind of ignored him or tried to, didn't want to, but eventually ended up giving my number, and as they say, rest is history.
Yeah, right.
That's a short version of it.
That's a short version, yeah. And then
yeah, no, I can appreciate that. I can appreciate that. I think I'll say for myself, in terms of my wife, there was absolutely the tenacity that I would say that I put into pursuing her, and then at the best she was going to give me coffee, and I pushed and made sure that was dinner. And then as to steal your line, then obviously, yeah, the rest is history. As my little guy is upstairs, so things are going okay. Now so obviously with that, let's skip ahead. The idea of UpaCare, an interesting one. Maybe give us a little bit of background. Maybe give us, give us some background in terms of the vision, the philosophy, and then how that came about, the idea for it all.
Absolutely. So I guess for those that don't know what UpaCare is, it's a hybrid digital primary healthcare model. So that means we do sort of primary healthcare, but at the core of it, we've got a digital platform, and we use tech for our patients to basically make their lives a lot easier and make healthcare more seamless. The way we initially started, so actually it started about, I think, like 5 years ago now. Sumitra and I went to Nepal to visit family and friends. And we were like massively inundated with friends and family who kind of wanted us to look at their medical investigations and medical records and kind of help them understand what was going on and what their conditions meant. And it became really clear that there was, I guess, like chronic confusion about what their healthcare needs really were. They didn't understand a lot of the conditions. But not only that, most people are burdened with carrying their own medical records themselves and looking after their entire family's medical records. So they've got to coordinate and manage everyone's health, which when you have a big extended family is a massive responsibility, especially if you're not in healthcare yourself. And it just became really apparent that things were really fragmented and disjointed. And we both realized that primary care would solve a lot of these problems. So for those who don't really know much about primary care, it's kind of very well established in the UK and in countries like the US, Australia, and the continent of Europe. And we know from lots of research from WHO that actually good primary healthcare infrastructure will give better health outcomes for the population and reduce morbidity and mortality. So we know that countries that have good primary care, we know it works for those countries. So for example, if I was in the UK and need to see someone, I would go to my primary care clinic because they know me, they've got my data, it's local, and it's run by generalists who are really highly skilled at addressing a broad range of medical problems. And normally 90% of that can be covered in the community in primary care without you even needing to go to hospital. But when you do need to go, they'll refer you. So your data is sent to the hospital. And once the specialist has seen you, they send it back. So there's that loop, that ecosystem for health. So data isn't lost and it's not put on the patient to have to manage the in-between. And that's what we felt Nepal really needed. But I think a bit of a problem with the culture in Nepal is the focus a lot is on seeing a specialist. So patients want to see a specialist for things. And of course, there is definitely a place for specialists, but there's also a massive place for generalists too, and they're equally important. So a generalist can help diagnose, like I said, a lot of problems in the community without even needing that secondary care, but also they can help coordinate the whole person care in one place as well. So there really is, they're equally important, and there is a time and place for both of them. So that's generally how we felt that we needed to introduce primary care. And initially we were actually going to introduce like just analog clinics, so just set up some clinics. And then we talked to our other co-founder, Sandeep, who comes from an engineering background, is very creative and tech savvy. And he was basically saying, well, actually, guys, like, yes, primary care is needed, but if we can digitize it and make this like a hybrid model, then we can serve the population better and make it a lot more accessible. So that's when we then got in touch with Fusemachines, and so UpaCare was born.
Right. I mean, that's brilliant. And you've absolutely made me recognize that I have at times, and I try not to anymore, take for granted having trained physicians in the family. There's times in which I remember distinctly, I hurt myself ridiculously playing basketball and sprained my finger to just an awful comical degree. And then, as I always do, I call my sister, and within her network, she can get me into her hospital, what have you. But I had been playing in an area that she's like, sorry, dude, I haven't worked in there. You're just gonna have to fend for yourself. But it is something to be said about fending for yourself is what most folks have to do, and you have to pay attention. You've got to understand that perhaps you're not getting the best care, perhaps that this person is an expert, your own records, your own medication. I know, our family has to pay attention. My mother is, has quite the cocktail that she needs to pay attention to, but you're kind of left to your own. We do have access to those digital records. We've got the access to that information, and how much relief and calm that would give you if you knew that you were being taken care of. It's daunting. I'm the computer guy in my family. If tons of questions about computers or cars, ask me. But in this incredibly important avenue, you guys are able to provide that access to folks that don't have, a doctor married to another doctor in the family as I do. That's exciting.
Yeah, and even if you were a doctor, for example, if you are an orthopedic doctor, your specialty is orthopedic. So if you go to them and say, if they might be your brother or whoever, and you say, I've got muscle ache,
Absolutely.
because the way they see things is, very much tunnel vision. They know a lot about orthopedics, but
Sure.
they don't necessarily have that general knowledge, right, of what a generalist would have. So you can go into this like a tunnel vision and think, it could be this, that's orthopedic related, when in fact it might just be that you've got a generalized infection and that's why you've got muscle ache. Right. I mean, it's that, it's that knowledge that a generalist have, that maybe when you seek a specialist, you may not necessarily get the same knowledge. You'll get brilliant knowledge, but
sure.
Absolutely.
It makes perfect sense that you need that kind of connecting tissue and someone that can step back a little bit and not be hyper focused in that particular area. No, that makes perfect sense. Now, obviously, the connection to Fuse and where we're going to be working together. Maybe you can give us a little bit more detail in terms of what the scope of work is going to look like and how UpaCare and Fuse are going to be working together.
Yeah, of course. So as we mentioned, we're sort of a hybrid model. So from the onset, we wanted an interdisciplinary approach between like health professionals and computer scientists to sort of create the future of how healthcare is going to be received. We've actually already started working with Fusemachines. So we started working with them back in summer, and we've been discussing how we can use tech and AI to automate workflow processes, make healthcare seamless, and also look at how we can incorporate AI and look at tagging data. So in the future, we can aid in diagnostics. Our primary target with Fuse really is to make sure that whatever we're developing is giving the patient seamless healthcare and making life easy for both doctor and patient, but also we want the software to be impactful and make a big difference. I think with Fuse, where things have worked really well is that they completely understood our vision from day one, and they absolutely matched us with passion. So they matched us exactly how we wanted in passion. And I think because of that, we've worked really well together. It's been really fun, creative, and innovative. And it's something I think both teams are really proud of what we developed.
Yeah.
Right. And the impact is what's really, really striking for me in terms of what you're going to build. I mean, obviously I'm getting ahead, but the idea that what you're building can aid in diagnostics in particular, and in terms of adding an increased level of precision and adding speed to all of that, adding in that also for someone like me, a layman, being able to have access to that type of information in a way that makes sense for me with all of those other factors is really exciting. It's just the scalability of all this. I obviously, in my role here, I'm getting way ahead of myself. I'm seeing you guys taking over the planet. But having said that, that first step towards that vision and doing it in this use case and perhaps in one clinic, in a series of clinics, in one country, in a series of countries, I see that as an absolute possibility, and if not an inevitability, and that you've built it. And I know with the tools that we build, there's that scalability baked into the thing that we build. So your vision done in a way, the process built out, the technology built out, the reusability built out. But it's interesting because the tools that we build, may not necessarily have that type of a social impact, a health impact, a people impact. Truthfully, this, a client needs something, we'll build it. This one, I think, is, I'll speak for, I'm very connected to kind of our delivery teams and our engineers. This one's kind of definitely, you spoke of that matched passion. I absolutely can second that, in that I've had the conversations with the teams, and I know that, again, working with you, and the reason why I wanted to make sure I was excited to have this conversation is because we've been talking about you guys for since the summer, so quite excited.
Thank you.
Hopefully all good.
I can absolutely it's just been a very organic, very it's the passion just gets baked into the work. And I mean, what else do we all kind of want to do with that? We want to come to work energized, but if you're working on something that's going to have that impact and the potential to have pretty significant impact, we're all very excited here.
Fingers crossed.
Yeah, fingers crossed. But I think we've got a lot of belief in your leadership, and we've got a lot of belief in our team as well. In order to get us to the finish line here.
Absolutely. I mean, Fusemachines team have been brilliant. Without a doubt. Highly recommended.
Yeah, definitely.
So we've spoken about kind of the current state of primary care, or I guess the current state of healthcare in Nepal, and we've spoken about kind of what your vision for primary care in Nepal. That digitization seems like a simple aspect, but why is it important to get to push digitization within healthcare?
Well,
Are you taking this one?
Yeah.
Okay.
I'll do this.
Okay.
So I think, digitization is the future, and all other industries have innovated and evolved to reflect how, as societies, we communicate, but also how we receive services. So from how we get our money to even how we get our groceries. I think healthcare has lagged a bit behind in innovation, and there is a lot of opportunity to make big impact on population health throughout the power of people's smartphones and changing that point of care. So through digitizing health, we can make healthcare more accessible. And although it is lagging, we are seeing it evolve. And when we are implementing sort of digitization, it means that we are essentially needing less extensive physical infrastructure. We can streamline processes more and use resources a lot more effectively, which again makes it more sustainable. So, which is obviously very important, with the current climate and how things are. So I guess all of that means that really that's why healthcare needs to get digitized. We need to sort of achieve all those goals.
Yeah.
Right. I can also, one thing that I've heard recently in terms of it's funny, I've just kind of looked at the last decade and how quickly things have changed. I feel a lot older than I feel like I should. And one of the other reasons was that, again, that digitization of information coupled with computer processing power, coupled with access to super high-speed internet, allows us to build out solutions that we've dreamed about for 50 years. And in this in this time period, it's going to be quite an asymptotic rise to new solutions and new ideas that we're having. And I imagine that you guys are going to benefit quite a bit from all of that happening. Processing power, I think, is kind of the next way we get into quantum computing, and then being able to crunch numbers that much more quickly. Going back to the diagnostics, something that would have required 10, 15 years of education could potentially with supercomputing be done through computer vision, and then that processing power is going to be pretty interesting in terms of what we can do. I imagine you guys might have some other ideas in terms of how technology in general can kind of help doctors in terms of, I imagine there are applications for physical, psychological, social problems almost on a daily basis.
Yeah, so I mean, I think technology provides, as we've already discussed, it provides a different avenue by which doctors and healthcare professionals can reach patients. And that traditional interaction between physician and patient is no longer limited to the confines of a physical clinical consultation room. And technology allows for that continued therapeutic relationship to go beyond the consultation. So with our app, to address, as you've mentioned, sort of physical, psychological, and social well-being, we essentially want to become a health and well-being and lifestyle app that patients interact with on a daily basis. So it becomes an integral part of their everyday life. They can look on their app, for example, to get personalized, holistic care that is tailored just for them. So, for example, meditation advice, nutrition advice, but also what medication they need to take that day, what things they need to do, when their next appointment is. So it kind of becomes, essentially their health style guide, really, and something they interact with on a daily basis.
Right. Now that's brilliant, because good Lord, do I spend a lot of time staring at my phone. But the idea, I've flirted with, help apps to help me with, with diet and nutrition. I've had apps that have helped me with meditation. But the idea that not only would I have it in one spot addressing all of those areas, but then having kind of the machine learning behind it and have it be tailored and not just be, and I think there is a benefit to something maybe just boilerplate, written in stone and passed to me. I think I could benefit from something like that. But for you to build something that's looking at me, my life, my stresses, my complete lack of self-care, and be able to give me those, I imagine, bite-sized amounts of information that I can actually action on. I mean, it just, these days, this week's been quite busy, and I'm just trying to get done whatever I need to kind of get done. And what the first thing that I sacrifice is myself in terms of care. But if someone just kind of digitally tapped me on the shoulder and said, "Hey man, this morning you just kind of take care of this thing." The world's been obviously insane the last few years. You guys have both spoken about the there's no limits right now in terms of physical space, which I found really interesting. I've been able to build really, really strong relationships across an ocean, which I've always been shocked at. But also now I feel very connected to other parts of the world, my team in Nepal, my team in New York, and paying very much attention to kind of healthcare, overall healthcare of different countries. It's been interesting to see what's spiked and what's changed, and what has been interesting. And I think in our conversations with you, finding out the rise of non-communicable diseases such as heart disease, cancer, diabetes, and the fact that those are now the leading cause of death worldwide. I mean, my stats might be off, but definitely significant, and representing an emerging global health threat. And if my numbers might be off, but I what I had last check was the death from NCDs had now exceeded all communicable disease deaths combined, and that's been shocking to me. Could you guys talk a little bit about that rise in NCDs and how good primary care can stem from that?
Yeah, and of course, I think you have explained what NCDs is beautifully. So essentially, it's a group of conditions that are not usually caused by an acute infection. So, previously when people died of infection or, during birth, whereas now these NCDs, so chronic conditions like stroke, COPD, and diabetes, account for 71% of deaths globally, which is huge. And unfortunately, 77% of all NCD deaths are in low and middle income countries, so countries like Nepal, which is really sad, because not only do these countries are affected by communicable diseases, but this is such a growing pandemic, I suppose, of non-communicable diseases, but not able to meet the needs of the people to manage it almost. The root cause of many of these conditions are lifestyle factors and genetics. However, lifestyle factors can be modified, and as such, diseases can be prevented. This is where primary care really comes into its own. The therapeutic relationship that you established in primary care allows the clinician and their team to identify patients and their risk of disease, and so you can intervene early as a result of that. Whereas, in contrast, say, for example, in hospital specialists, when you go and see them, they typically only see patients regarding a particular condition in a snapshot setting. Hence, you miss this opportunity to intervene. A primary care physician who not only knows you, but also knows, say, for example, your family's history or your social history, can look at you as a whole person rather than just a disease or a chronic condition that you've come to seek help for. And hence, by optimizing that patient's lifestyle, risk factors, and their chronic illness, they will ultimately help patients to live their happiest and healthiest lives. So I think it's very clear that a good primary healthcare is an essential, almost precondition for any healthcare system. And so going forward, it's clear that implementing effective primary healthcare infrastructure will just lay the foundations for essentially better healthcare for all. So this is why primary care can really help with non-communicable diseases, not only help, kind of champion it, I suppose. Would you agree?
Yeah.
Yeah.
Right. No, and it's so interesting that you say that. You made me recognize that. So I mentioned that my younger sister lives with my mom, so she lives in the house that we kind of grew up in. And but she's what I found interesting is our primary care physician, the one that I had as you know, in my youth, now sees my niece and my nephew who are 8 and 4. So so with but I didn't recognize, because Dr. Tanaka knew me from my youth, knew my family, knew us, knew how we grew up, knew what fields we studied in school, knew what our current careers are, knew lives in the area where we live in, so has a really good sense of what the community is like, has known, and I never realized this, but because he knows my family so well, my sister so well, that when it's time to start looking after her children, he will natively have that information and understand a lot more, such that the greatest specialist in the world that you might have access to, that gets your information, I'm not even sure what type of slice of information that they would get, doesn't have that history. Like Dr. Tanaka knows me, knows my family. I've moved away, and he doesn't take care of my family at this point. But the fact that he asks about me, he knows my sister. He knew my older sister when she was in school, and that she wanted to become a doctor, and he was kind of key in some of those early conversations with her. It's so intertwined. Very interesting. I never made the connection back that is going to make him be able to care for my family and my extended family that much better.
Absolutely. And he's almost I don't know how to describe it, but when you call him a family doctor, that is what he is, right? He's there looking out for you. He's not just going to spend 2 minutes because you're there to see him about disease or condition. He genuinely, like, family doctors genuinely do care about you, and because they are involved in your life.
If you're lucky enough to have someone in your life like that,
yeah, of course.
And I'll go back to the technology aspect of it. If I can empower my healthcare providers with that much more information, ability to diagnose, history, analysis, all of that, then in those cases, even as much as they may care for my family, there's a limit to the cognition of a human being. And you can enhance that. I don't think there's a world in which I don't think in my lifetime I'm going to be seeing when I say a virtual doctor, an artificial intelligence to be taking care of me. But I absolutely do think in my lifetime to be enhanced by that, and to have that human being have that extra information, all the better. It just takes that one disruption story to come in, and then hopefully ideally kind of push everyone forward. But I am excited to be connected to folks that are on the kind of bleeding edge of that.
So are we. We're very excited. I think essentially this is where the world is heading, and hopefully we can be the pioneers in trying to do that in Asia, especially starting in Nepal, just because technology, although we do have internet here, and it's probably better than landline and things like that, but in terms of innovation, doesn't always come from places like Nepal. So we're excited to be starting out here and getting to know the population here, and getting to learn more about what affects the population here, and how it is different from the Western world, for example. Very excited about it.
Yeah. And I'll piggyback on that a little bit in terms of perhaps the world isn't as familiar with Nepal in terms of kind of our technology and engineering talent, but the one thing I absolutely see, our engineers flourish now with that access to that training. We're very proud of our fellowship and the engineers that go through it. Samir being our CEO, Samir Maski being our CEO, but being a PhD at Columbia, for him to recognize that the quality of talent and the ability is on par with his students at, you know, a preeminent school of engineering is exciting. So that, you know, regardless of the project, you know, I think we're excited. There's never anything that, oh, we don't have the talent to do that. You know, I would absolutely put us up against the best of the best around the world in terms of machine learning and data talent. But we are also a services company. So again, I've said it 1,000 times been in this podcast, but being tied to passionate people looking to make change and have that vision, you know, again, our folks will absolutely be, you know, excited to help build that. I really enjoyed our time together. As I'd said before, I had been dying to finally get some FaceTime with the both of you, and I imagine that you do need to get back to your day jobs, back to your family. But what I did very much want to follow up with and finish off with was, what is next for UpaCare and both of you specifically?
Yeah, so I guess from the business perspective, where our FDI is nearly through, so we'll be launching as a UK company in Nepal very shortly. We're looking now at managing operations and recruitment, and with regards to Fuse, we're like continue to work with the app. We're kind of at the point where we've nearly completed, but we're just working on our MVP and working on things that we think are more essential. So yeah, so it's kind of an ongoing process, but it's kind of getting there now. So we're getting to that point where we're actually getting ready to start, which is quite exciting, because we've been working on this for a while. So to actually see it to fruition is really exciting.
Yeah, and on a personal level, we're obviously trying to do more play dates, just like with Ruchi and other families, and get to know people in Nepal.
Absolutely. Well, Ruchi is one of my favorite people, not just at Fuse, but just in general, as one of my colleagues.
Yeah,
I can definitely see that. We've met her once, and we're fans, aren't we?
We are.
Yeah. I'm a big fan. I'm going to be incredibly jealous of your play date. But again, wishing you all the best, and I will be paying very close attention to your successes and making sure to watch your story and sharing any of your successes on our socials and my personal as well, because again, just very excited for the work that you're going to be doing. Thank you both for your time. I know you're incredibly busy, but excited for your success, and hopefully we'll talk soon.
That's great. Thanks very much.
Thank you everyone.
Take care, guys.
Thanks, Ruchi, Lizzie. Bye now.